There are literally dozens of factors that can increase the risk of injury from a low-speed car crash. A few of these include head restraint positioning, occupant gender, occupant position, and occupant awareness of the impact. Head restraints are probably the easiest way to prevent injuries from rear-end car crashes. Unfortunately, many people are injured each year because of an inadequate or improperly adjusted head restraint. In 1997, the Insurance Institute for Highway Safety studied 200 different new vehicles and reported that only 3% were found to merit a good rating. More than half of the head restraints in these new cars were graded poor at protecting occupants from injury in rear-end collision. Poor design is just one part of the problem. The second part is that most people think of head restraints as head rests and adjust them too low. A 1996 study by some British researchers recorded the head restraint position of 1,900 vehicles at an intersection. They found that only 25% of these vehicles had the head restraints adjusted in the up position. A properly designed and adjusted head restraint can make a big difference in the risk of injury during a low-speed crash. Here we see an animation of a collision with no restraint. And one with a proper restraint. A good head restraint protects the cervical spine by reducing the amount of differential movement between the torso and the head, and can eliminate the S-shaped curve that can cause injury to the spine. The key to proper head restraint adjustment is to increase its height and reduce the horizontal distance between the head and the restraint. According to insurance industry guidelines, a good head restraint is positioned no lower than a few inches from the top of the head and no more than a few inches behind the head. A study conducted by the insurance industry examined the role of head restraint position in a large number of people injured in rear-end collisions. They found that 29% of women drivers reported neck symptoms with a head restraint 0 centimeters below the head's center of gravity. But 69% reported symptoms when the restraint was more than 6 centimeters below the head's center of gravity. So, a properly adjusted head restraint can dramatically reduce the chance of injury in these crashes. Another factor that increases the risk of injury is gender. Consistently over the last 40 years, research shows that women are much more likely to be injured in a rear-end collision than are men. Various explanations for this phenomena have been put forward, but the latest studies seem to show that it's the smaller size of the female neck that increases the chance of injury. A Dutch study from 1998 reported that a 20% reduction in neck circumference resulted in peak head accelerations nearly 2.5 times larger. Occupant position is yet another factor that can increase or decrease the risk of injury. Engineers who conduct low-speed crash tests with human volunteers make sure that each occupant is facing straight forward, sitting upright, and has a proper head restraint. They do this to remove any possibility of injury in the volunteers. In the real world, an occupant who is tall may be injured because the head restraint is too low to protect him or her. Or, the occupant may be leaning forward, which can dramatically alter the amount of acceleration that the torso experiences in a crash. And probably the most dangerous position for an occupant to be in during a crash is with the head turned to the side. Why? Because the human head and neck cannot simultaneously rotate and extend. You can try this for yourself. First, bend your neck backwards. Next, turn your head to the side and then try to bend your neck backwards. It is very difficult. Now imagine your head turned to the side while being struck from behind. We turn our heads routinely while driving, whether from talking to a passenger in the car, from looking around while stopped at a red light, or from turning in reflex upon hearing skidding tires just as we're about to be rear-ended. The bottom line is that most occupants are not sitting in their car seats in a way that will prevent injury during a crash. Asking whiplash patients about their position at the time of the impact is important, as it may help explain some of the patient's symptoms. The final risk factor that we will look at is occupant awareness. The medical literature on whiplash is fairly clear that occupants who are aware that they are about to be hit and have a chance to brace themselves are less likely to be injured than those who are unaware. An occupant who braces for the impact has a better chance of preventing the abnormal motions that cause injury to the spine.